Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week beginning August 30th, 2020. As we know, this is a pandemic that began in China and then quickly spread to Europe, followed by North America and then South America. And by the end of April, was pretty much everywhere in the world. It started slow with a few hundred deaths cumulative until about the middle of March, when it began to increase rather rapidly. It has been increasing every week since then. And this week hitting almost 850,000 deaths worldwide and 25 million confirmed cases, with a weekly increase of about 4.8%. So there's almost 5% more deaths this week. But remember, both of these numbers, the total number of deaths and the confirmed cases, are tremendous underestimates because there are so many places in the world that can't test and don't have the capacity to report. But given that these are the numbers we've been following, this is where we are this week. It's helpful to think of the pandemic evolving at different places at different times, so that in South Africa, for example, you have a very rapid growth rate, Brazil still increasing, the US slowing down a little bit, and then countries like Belgium leveling off. So they still have a few more deaths, but nothing like the rapid growth rate that we see in other countries. If you look at all the top 25 countries in the world, 8 weeks ago on July 5th, we ranked all 25 for deaths per million. That's how much impact there is. And we color-coded it so that white was Europe, blue was North America, pink was South America, and yellow was other. Now, 8 weeks later, we're doing the same thing. And we'll color code them the same way. And now I'm going to put August 30th next to July 5th. So in 8 weeks, this is what's happened in the world. The most obvious thing is, for the first time since we've been reporting, Belgium is not the most heavily impacted country in the world. In fact, it is now Peru in terms of deaths per million. The United States is still in the top 10. Though we've dropped a couple of places, but we've still increased rather significantly. The other interesting point is that 8 weeks ago, it only took 77 deaths per million to make the top 25. Now it's almost triple that. And then you can look at this chart overall and really see that what's happening is that while Europe is still heavily impacted, they're not growing that much. And where we're seeing the growth is in the Americas and now in other places. This is a chart that WHO puts out, and you can see early on it was China, followed by Europe, where the rapid growth was, and now it's in the Americas and increasingly in Southeast Asia. So we're in the midst of a global pandemic. There is some good news in this, I think, and that is if you look at the four most heavily impacted countries in Europe, you see this rather consistent pattern, that after rapid growth, they tend to level off. And this is the same in the four most impacted states in the United States. So what this suggests to us is that in time, we're going to see leveling off in all of the places where the pandemic has been impacted. And hopefully we'll no longer continue to see these different patterns, and that the US, the world will all start leveling off. But we're not there yet. It's still a serious pandemic. It is still a global pandemic. It is still killing a lot of people around the world. And we have to continue to work together in neighborhoods, in states, in countries, and around the world to bring this pandemic to an end. There's a great deal more information about COVID-19 on the College of Public Health website. If you go and click on this link, you can see a variety of different videos. If you know anyone who'd like to be added to our mailing list, please let Jan Stork know. And as always, if you have any questions or comments, please don't hesitate to let me know. I'd be happy to try to find an answer for you, and certainly glad to hear from you. Thank you very much.